I am Professor Dr. Siddhartha Das. I am patron of RSSDI. I was head of the Department of Medicine, then Dean and Principal of SC Medical College and Hospital, Cuttack, Odisha. The topic I discussed was ectopic fat and its relevance to diabetes and cardiovascular disease. The entire focus is on visceral adiposity, and we all know that visceral adiposity leads to insulin resistance, to a procoagulative state, and it's definitely the visceral adipocytes work as a huge endocrine organ. But the issue is that people who are not obese do develop myocardial infarction, do develop stroke, or have more of vascular burden, complications due to cardiovascular diseases. And so the focus is now also attracted towards ectopic fat. Ectopic fat means deposition of fat in non-adipose tissue, inside the skeletal muscle cells, inside the hepatocytes, inside the myocardiocytes, as well as fat deposited in and around organs like the heart, the kidney, the pancreas, and also in the neck. So these ectopic fat, they do induce insulin resistance. What happens? The fat inside the cells are triglycerides. They break into free fatty acids. The free fatty acids are used as energy. But here, because of metabolic dysregulation, these free fatty acids are not utilized for energy purposes. They break down to further downgrading products like diacylglycerol and ceramides. And these breakdown products, they induce or impair the action of insulin on the target cells. And insulin is a protein hormone which not only helps in glucose homeostasis by acting on the target cells, it also stimulates growth, glycogen synthesis, lipid metabolism, and cell metabolism on the whole. So here what happens, that there is lack of lipid metabolism, there is suppression of the PI3 kinase system, and this leads to insulin resistance, dyslipidemia, and leads to a procoagulatory state. So fat in non-adipose tissue, or the ectopic fat, has become very important. Though there is no specific treatment for it, but definitely lowering the triglyceride levels by pharmacological medications is important. Lifestyle modification, especially physical exercise and activity, helps in reducing the intramyocellular fat and definitely helps in revival of the myocardial function, skeletal muscle function. If you do a serial echocardiography and where the epicardial fat, the paracoronary fat, they have reduced in quantity by different measures, one observes that the ventricular function improves, and especially diastolic dysfunction definitely goes down. So this is how ectopic fat can adversely affect the biomechanics of the organ and lead to enhanced atherosclerosis and cardiovascular disease. Thank you.